Okay, well, on behalf of Sukavu, welcome. We're excited that you guys are here for this call, excited for all the incredible information that we're going to learn. I love coming on these Saturday calls. I have learned so much. I mean, I thought that I knew stuff about cannabinoids, and then we started doing these Saturday calls, and wow, the information has just been spectacular, absolutely spectacular. So I'm super excited to learn more about how cannabinoids can help autoimmune things. So that's going to be an incredible meeting. I'm super excited about it. Thank you for putting in all the hard work and for coming and being here and being part of this. One of our core values at Sukavu is teaching and learning and giving back to the community. So being able to give back to those that have helped us, those who are on the front line of things, and we're grateful for the opportunity to be able to give of our knowledge to others. So that's one of our values. We want to make sure that we're teaching and training and being able to serve those that have helped us. We appreciate that. Thank you so much. Dr. Liddy, I believe I've made you a co-host already, so you should be good to start whenever you're ready. Thank you so much for doing this for us.
Very good. Thank you so much. I'll start by sharing my screen. Let's see here. I believe this is the right screen. Okay, can you see the presentation?
Yep, that looks beautiful.
Wonderful. All right, so today we're going to talk about cannabinoids and autoimmune disorders. Autoimmune disorders are very common. They cause a lot of pain and havoc in the general population, decreasing quality of life. And we're going to just quickly go through what we have here. I hope the slideshow looks okay from your end. Okay, very good. So Kavu, as we know, is not just a lifestyle, it is a philosophy. Supreme products are the first priority of Sukavu, and it is a company that loves science and uses science to produce amazing products for beauty, for health, for performance. There are several opportunities with Sukavu. You can be part of this, or you can just enjoy the products. And the products provide all of us, and I've been using them, with a broad range of benefits that cannot be found elsewhere, and allows you to feel relaxed, refreshed, energized, inside out. And there's a really great line of products. You can pick and choose which one you want to try based on your underlying health conditions. So that said, what are autoimmune disorders? Autoimmune disorders are diseases that involve your body producing antibodies that attack your own tissues. So there are organ-specific autoimmune diseases and there are non-organ specific autoimmune diseases, also called systemic autoimmune disorders. For example, I can give you a quick example, like an organ-specific autoimmune disease could be Hashimoto's thyroiditis. We'll go more into some of those examples, but I just want to just put these things in your brain where it is one tissue that is attacked and it is causing just a thyroid problem. Hashimoto's causes your thyroid to become underactive. Your body is producing antibodies that is destroying your thyroid cells by causing inflammation, and then slowly you start needing thyroid hormone. And then there are non-organ specific autoimmune diseases like lupus, where you have several organs that can be attacked in that particular disorder. So I hope that puts things in perspective in people's minds. And so autoimmune diseases really is a dysfunctional situation. It's not normal. Your body is not supposed to attack itself. Your body is not supposed to attack its own tissues. And so with these autoimmune diseases, you have broken your self-tolerance, your ability to recognize that this is your own tissue. And then because of that, you produce antibodies that attack your normal cells. And for example, we gave already Hashimoto's as an example of like just a very specific organ or a generalized thing like lupus. There's other examples like type 1 diabetes, where you have islet cell antibodies or GAD65 antibodies, which are all antibodies that attack your cells that produce insulin. They're called beta cells in the pancreas. And as a result, those cells fail, they don't produce enough insulin, your blood glucose readings start going high, and you develop type 1 diabetes. Another example is multiple sclerosis. Those people who have multiple sclerosis or who have a relative with multiple sclerosis will realize it's a very debilitating disorder. It causes a lot of emotional and physical challenges for the patients who are going through it. There are variable extents of affliction, but generally it's not a pleasant disorder to have. Rheumatoid arthritis is another one. And so researchers have been working at developing therapeutic strategies that are aimed at controlling the immune system. And at the same time, there's always a risk, for example, if you take steroids, that you can increase your risk of infection. And so they're coming up with all these other new therapies that will control diseases without lowering its the ability of your own body to fight other infections and germs that can attack your body. I give the example of prednisone because it's very often used in many autoimmune disorders. And it works really, really well. For example, you can have lupus flare and they give you a massive amount of prednisone and other immune modulating agents. But then you can develop diabetes, weight gain, suppressed immune system in general, and you're exposed to more risk of infection, bone loss, and things like that. So this table gives you a whole array. The list is obviously not exhaustive, but this gives you approximately the most common autoimmune disorders that we find. We have Addison's disease, which is an immune attack on your adrenal glands, ankylosing spondylitis, which is unfortunate, cause a lot of stiffness in your spine and things like that. Autoimmune hemolytic anemias, you can go through the list. Crohn's disease, many people have Crohn's disease. Lupus, as I mentioned a little earlier. Graves' disease, which is another attack or autoimmune attack on your thyroid, but this time you're producing antibodies that are stimulating your thyroid to work too hard, and then you become overactive. And your thyroid is not listening to itself because it's just working and producing more and more thyroid hormones. We spoke about Hashimoto's. We are seeing a lot of Guillain-Barré syndromes with certain immunizations where you just have progressive weakness that is ascending. Sometimes it can paralyze even your diaphragm and making it hard for you to breathe on your own, things like that. We spoke about multiple sclerosis, there's leukoid hepatitis, it is exhaustive. There's so many autoimmune disorders. Name it, and there are so many. It affects every organ system that pernicious anemia, polymyalgia rheumatica, sarcoidosis, rheumatoid. A lot of people could recognize some of their family histories in this list of diseases that I'm projecting here. So about 10% of the people in industrialized countries actually have autoimmune diseases. And the more up north you go, Scandinavian countries, Sweden, Norway, the colder the temperature for some reason, the more you're prone to autoimmune disorders. So if you look at prevalences of type 1 diabetes and all those kinds of thyroid disorders, they're more common the upper north you go. So African countries, warmer regions, they have a little bit less. It doesn't mean it's in existence, it's just a little less. All right, and most of the people that are affected with this immunologic disarray is women. So women are disproportionately affected compared to men. All right. So this table just gives us a prevalence of autoimmune disorders. And as we can see, Hashimoto's thyroiditis is probably one of the most prevalent uh, autoimmune diseases. And Graves' disease comes next, celiac disease, type 1 diabetes. You know, it goes in that order. Um, so we already mentioned that there is a problem where you have a breakdown of your immune tolerance. You have a breakdown of your own uh, immune system so that you're not able to recognize your own cells and your antibodies are attacking your own tissues. So that is what we call a breakdown or a disruption of immune tolerance. And so we have all these disorders that result from this dysfunctioning of the immune system, but you also have multifactorial things that can affect your the manifestation of these disorders. We know that genes play a role in many autoimmune diseases. If you have a family history of type 1 diabetes or Hashimoto's thyroiditis, you are probably more likely also going to have a family history of Graves' disease or celiac disease or vitiligo and things like that. So autoimmune diseases tend to also occur in clusters. So there's a family history that plays a role because genes play a role. There's also hormonal environment, the microbiota, and it's really multifactorial influence that can cause the manifestations of these autoimmune disorders. And as we mentioned, we are working on many new therapies to control these diseases. I'm sorry that this slide is in French, and we thank God for Dr. Jume who prepared the slides. I didn't have, I just wasn't able to find the time to switch them to English, but I hope you understand and that you're able to follow. Okay. So this is just what we were talking about the breakdown of immune tolerance. And we've spoken about the genes, the environment, other endogenous factors, hormones, chronic inflammation. We already mentioned that even obesity is a chronic inflammatory state. So reducing inflammation is really important. Um, Intestinal microbiota and exogenous factors. In fact, a lot of people will develop, for example, type 1 diabetes. It usually starts with maybe a viral illness, and then your body is now producing antibodies against that virus. But there is some what they call molecular mimicry, where the virus, those antibodies are recognizing some proteins from that virus that are looking like some proteins on your cells. And then they start attacking on your beta cells, the pancreatic beta cells. And it attacks also your uh, beta cells. And then before you know it, you develop diabetes. So the beta cells are the cells that I mentioned before, are the cells that produce insulin in your pancreas. And so usually in kids who develop type 1 diabetes, you usually find that there was a viral illness maybe in the month or two before they started manifesting acute diabetes. All right. So many manifestations, how do these autoimmune disorders present? It just depends on the organ that is affected. For those that are organ specific, or if it's a systemic, it can also affect multiple organs. We already mentioned lupus can cause kidney disease, for example. It can cause myocarditis. You know, it's a systemic disorder. It can cause fatigue, weakness, you know, pleural effusions. That's how lupus is so more generalized. But the specific ones can also cause specific symptoms related to the organ that's affected. So Hashimoto's causes an underactive thyroid. You get fatigued, everything slows down in your body, you're gaining weight, your skin becomes dry, you become cold, you start losing your hair falls. Those are all symptoms of Hashimoto's. I cannot go through explaining all the symptoms of all the autoimmune diseases. We'll be here till tomorrow, but I'm just giving you an example of how an autoimmune disorder that is organ specific can manifest. If you develop type 1 diabetes, which is autoimmune, which is an autoimmune disorder, of course, then you will have excessive thirst, urination. You see a child who is lethargic, they're not thriving, they're losing weight, and they are wetting themselves. They were already toilet trained, all of a sudden their diapers are getting wet. They're just wetting themselves. They're not able to control their bladder. You have to start thinking maybe this is type 1 diabetes that is developing in this child. So other like enteritis or celiac disease, people who have celiac develop gluten intolerance. They can't tolerate gluten. Once they have gluten containing products, they develop bloating, abdominal discomfort, diarrhea. So it just depends on what or kind of autoimmune disease you have. I hope this is clear. As I hope that I'm breaking it down in a simple enough way for you to understand. All right. Diagnosis of autoimmune disorders. Generally, we go by your symptoms. There are generic markers that we can use, like a CRP, a sedimentation rate, complete blood counts. Those are things that we usually check in people that have autoimmune disorders. Uh, for example, if you have like a lupus disorder, and the doctor is searching, why are you always feeling sick, unwell, and they're not pinpointing, they might first check a generic thing like a SED rate and a CRP. All right. And then once they start kind of pinpointing the organ that is possibly affected, they can go into more specific antibodies, or the related to what they are thinking is the autoimmune disorder uh, that you are experiencing. So we already mentioned thyroiditis, autoimmune thyroiditis, which is also called Hashimoto's. You check thyroid peroxidase antibodies, for example. That is the antibody that we often check in Graves' disease. You check thyroid stimulating immunoglobulins or thyroid stimulating hormone receptor antibodies. So in Addison's, you usually check anti-adrenal antibodies, also called 21 21 hydroxylase antibody. And then there are different others like celiac disease. We can check tissue transglutaminase. We can check anti-gliadin antibodies. Those are all antibodies that are available for diagnosis of celiac disease. And then if you have vitiligo, all of a sudden you're losing pigment in your skin. It can be quite disfiguring. And a lot of people think Michael Jackson had vitiligo, and that's why he tried to bleach his skin, because his skin was very uneven. And so he wanted his skin to look more even, and he used extreme measures. He had the money to do it. Many people cannot afford a depigmentation therapy like that, where you just remove the pigment all over your body and you become, all of a sudden, a black person becomes white, pretty much. You know, the pigment, the melanin is what gives us pigment. And so black people have more melanin. That's the difference between the different races, how much pigment is under their skin. And vitiligo attacks your melanocytes, which are cells that produce pigment. So same thing with multiple sclerosis. There are antibodies that attack your spinal cord, your brain, and then you have all these lesions in your brain causing all these neurologic defects that you experience with multiple sclerosis. And these are the proteins, your myelin basic protein. I'm not here to really give you a science talk, but I hope you understand pretty much what we are trying to say. All right. So autoimmune disorders can go in different phases. You can have just a transient appearance of an antigen, and then you get antibodies. It's time limited, and then you resolve the problem. Sometimes it persists, and then sometimes it occurs slowly. An example of a slow appearance of an unusual antigen is people who develop type 1 diabetes at a late age. You'll see a lot of children have type 1 diabetes between the ages of 1 to 10, 1 to 15. But you see somebody who is 30 and they're telling them they have type 1 diabetes. They're like, how come I'm already 30? You see, but this is because the antibody titer is very low and it's just slowly developing in these people. They still have the same antibodies for type 1 diabetes. They're initially treated like type 2 because everybody thinks they're already 30 or 40, so it can't be type 1. But they quickly fail conventional treatments for diabetes, and then they end up needing insulin quite rapidly compared to the average time course of a typical person who has type 2 diabetes. So, and then sometimes you have intermittent appearance of an antigen. And I see this in a few patients who have thyroid disease. And you see somebody who has Hashimoto's thyroiditis, and they're like, doctor, I don't understand. Why am I one day I'm regulated and I'm doing well for maybe 2, 3 months, and then all of a sudden my body feels like I'm making thyroid hormone again, and then all of a sudden after like 6 months I start needing more, and these patients get frustrated. They change endocrinologists because they think that the doctor doesn't know what they're doing. And so I end up explaining to them is that sometimes you can have intermittent courses in these autoimmune disorders. And so that's why your course is looking so erratic. It's not the doctor's fault, it's actually your immune system that's misbehaving. All right. I think that we have really gone through this uh, 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 in detail. And if there are any questions, I can take it. Um, I don't want to disrupt the flow, but sometimes if you don't understand the foundation of what we're talking about, you may not understand the benefit of taking treatments that can help modulate your immune system. All right. So we discussed immune activation situations that cause an unfortunate attack on normal tissues. And we've spoken about other exogenous factors that could be playing a role. And we've spoken about the fact that uh, you're producing all these antibodies. It's causing all these deficits, all these hormonal issues. We also have in autoimmune disorders, we have a stimulation of what we call self-reactive cells and cytokine enhancers. Those things occur in autoimmune disorders where they just enhance this abnormal immunologic disorder. All right. That said, let's go to the treatment piece, and I hope that it's clear. Treatment of autoimmune disorders, we mentioned that steroids are often used because steroids are also anti-inflammatory. And unfortunately, steroids have a lot of side effects. If you have anybody in this meeting who has taken steroids before, they will realize that their skin starts thinning out. They'll realize that they start gaining weight, their face becomes round. If they take it for long enough, they retain fluids. And then in the long term, if you use it for many years, you can develop osteoporosis. It also weakens your immune system in general because it modulates your immune system and makes you prone to getting secondary infections. So if you're going to be on steroids for several weeks, usually your doctor has to put you on another medication to help you fight, just protect you from other infections that you can get because your immune system has been weakened by the steroids. So immune suppressing agents, you can already imagine they will definitely control your disease, but they also weaken your immunity, making you prone to other infections. Immune therapy is up and rising, really, really great developments in the management of autoimmune disorders. And then painkillers, if you're in pain, there are a lot of people who have rheumatologic disorders and they live in pain. It just destroys their quality of life. And then we have biotherapies and targeted therapies that are now available, and also specific treatments. But what we're going to focus eventually is how cannabinoids can help. All right. Because at the end of the day, our goal is to control the disease activity, to prevent flare-ups, to help, quality of life, socioeconomic integration. A lot of people have lost time from work because of autoimmune diseases, and also limit the consequences in the long term of these disorders. and side effects of treatment. So that is the therapeutic objectives of treatment of all these autoimmune disorders. Are we always successful? No, because we have some patients, if they are not on prednisone, they really can't survive. And then you find them just, having all the side effects associated with prednisone use. So cannabinoids, therefore, can be helpful. And we are going to look at the effects of cannabinoids on autoimmune diseases and their complications. So how can CBD help? CBD slows the progression of T cells and erase the memory of the immune system in those T cells so that it reduces the likelihood of future autoimmune attacks. All right, so those T cells are lymphocytes. They're those that are activated when you have this immune attack. And so this CBD slows the production of these cells. That is one thing that you need to know. The next thing is that CBD increases the expression of genes that deal with oxidative stress, and it reduces cell damage in autoimmune attacks. Remember, at the end, one of our treatment objectives is that we want to do preservation. We want to limit the deleterious effect of these immunologic attacks on your body. So for example, I have a cousin who has lupus nephritis, and she's very young and she has severe lupus nephritis. And there was concern that they could even put her on dialysis, and they had to give her very strong treatments like Cytoxan and high dose of steroids. Yeah, she was very concerned because she wants to be able to have children, and she didn't want to take a treatment that was going to destroy her ovaries. And they were actually even telling her that she needed to collect the eggs from her ovaries and preserve them for future reproduction if necessary. So you can see how impactful some of these autoimmune disorders can be in the lives of people. And if you can have a product that can actually help modulate some of these destructive effects of this autoimmune disease, of these autoimmune disorders on your own organs, I believe that it will really benefit people. You see, I'm not saying it's a cure, I'm just saying it's an adjunct. You can use it as an adjunct to limit damage. And we read that CBD increases expression of those genes that deal with oxidative stress. Oxidative stress leads to production of those free radicals that are very destructive. All right. And so by doing that, you reduce cell damage. And then because of this immune modulatory effect of CBD, it contributes to overall your body homeostasis. Okay. Then there is also an effect of CBD on pro-inflammatory cytokines in suppressing cytokine secretion and promoting anti-inflammatory effect. We saw this a little bit in our last two presentations when we spoke about obesity and when we spoke about diabetes, how obesity is a pro-inflammatory condition and how it also, that's why a lot of obese people have a lot of cancers. So if CBD can regulate inflammation, I believe that it is very important as an adjunct to your supplements that you're taking. All right. So obviously we mentioned earlier that there are a lot of environmental factors that can play a role in worsening an autoimmune disorder: sugar, red meat, alcohol, a lot of dairy can also be deleterious. Okay, very good. So CBD oil for autoimmune diseases, it's available. I actually have given it to my dad, who, as I mentioned, also has prostate cancer. I mentioned that there are different kinds of CBD, but I am using the cannabinoid oil from Sukevu. I'll show you. I have it right here. I don't know, my screen. I hope people can see it. And I believe that um, Rosa tried to give you a little bit of a dosing guideline on how to use them. And really, I just do 1/4 of a droplet because I don't have the patience to count 15 drops, to be honest. But I feel great after using them. Uh, it suppresses the effect of inflammation in your body. You feel great using it, but also it also suppresses the immune activation that happens in these autoimmune disorders. It can really help by reducing inflammation, as I mentioned, and it can help be helpful as an adjunct to your treatment, regardless of what autoimmune disorder you have. So I will not go into the molecular mTOR pathway on how CBD helps in multiple sclerosis. I believe that if you actually just heard and internalized what we have discussed so far, you will know that no matter what kind of autoimmune disorder you have, use the CBD products, you're going to see some benefits. All right. And so we have this whole spectrum of cannabinoids that are available. There are some the hemp oil, the hemp and pea protein, sorry. We have muscle gels, we have joint balms, and we have the different CBD oils. And then there's a muscle balm there, there's a joint balm. There is no lack in this product. So go online, find the one that will work for you, depending on the condition that you have, and purchase it. You will not regret it. And in conclusion, the pathogenesis of autoimmune diseases is complex. It's a complex condition, complex disorders, painful, impacting your quality of life, and just causing pain in the lives of many people, particularly rheumatologic ones, lupus. Those are some of the worst ones to have. Things like Hashimoto's, you can always replace thyroid hormone. That's not such a problem. But there are some of these autoimmune disorders that are pain, celiac disease, very difficult. All right. And so the pathogenesis of autoimmune disease is complex, as we said, heterogeneous between autoimmune diseases. It's not fully and completely understood, and it involves a large number of molecular pathways and interactions between your immune system and your inflammation and environment and genes. Um, so look into the products and get one of them. Look at there's a whole pamphlet online. If you look at the products, you'll see what it can be useful for and get them. You'll not regret it. I can say I promised to tell people whether my weight loss was going to progress. And I can tell you that I lost 3 pounds this week. So this is very powerful because for somebody who has not been able to lose weight, uh, I am very grateful that I'm able to lose weight. All right. So my total weight loss now is almost 10 pounds. So which is fabulous. All right. That was my promise that I was going to update you about my weight. I have come to the end of my presentation. I hope it was educational for all of you. I'll pass it over to the French speaking presenter at this time, unless Rosa wants to say anything, or Tammy.
Dr. Liddy, that's so amazing. I'm so excited for you losing that weight. That's so great. That's awesome. And thank you so much. That was an incredible presentation. We do have one person that had a question. Marty's wondering if you can explain why the CBD hasn't helped her thyroid. So I'm wondering if maybe she needs to up it a little, or,
Yeah. So maybe if you can, so that's why I tell you, you have to start before the destruction is complete. If you have type 1 diabetes and your beta cells are completely filled and your C-peptide level is 0, it's not going to rebuild it. Okay. So, but if you start having signs of Hashimoto's, and the antibodies are there, but your thyroid is not completely destroyed, then you can preserve at least what you have left. So as I mentioned, it's not a cure, but it can help modulate the immune attack that you have. All right, so if you already, let's say if you weigh 60 kilograms and you're needing 120 micrograms of levothyroxine to control your thyroid, it means your thyroid is dead pretty much. It's not going to help your thyroid because you have already destroyed pretty much all your thyroid function. But because the amount of thyroid hormone you need, if your thyroid is taken out, is about 1.6 or 1.7 micrograms per kilogram per day. So look at your weight, calculate it using that formula. If you're needing more thyroid hormone than that, it means that you have destroyed your thyroid. We are not going to reverse it, but you can prevent yourself from other autoimmune disorders. Remember, if you have one, you can have another. That is why there's something called autoimmune polyglandular syndrome, where you see somebody with type 1 diabetes, Hashimoto's thyroiditis, and Addison's. Or you have type 1 diabetes, Hashimoto's, and celiac disease. Or you have type 1 diabetes, Hashimoto's, and autoimmune hepatitis. So it cannot reverse something that's completely gone, but it might help modulate and preserve what you have. So I hope that answered that question.
Yeah, she's shaking her head. Yes, yes. So that was perfect.
Very good.
There's a couple more in here. Can it help sickle cell patient? And then can it help someone with Alzheimer's or dementia?
All right, sickle cell disease is a different kind of disease. It's a genetic disorder. It's not autoimmune. It's just that you have what we call it a sickle cell gene. And so your red blood cells have the propensity to just become sickled. And there's impaired oxygenation or oxygen transportation through those cells. They tend to clump together and they cause crisis. So that's a different kind of disease. And it's not autoimmune. I've not looked at the effect of CBD on sickling. Maybe that is a little bit of subject for research that we can do. A lot of people are carrying out research in this field, in the CBD field. As we know, with the legalization of marijuana, there are dispensaries everywhere. People also are looking into how it can help people. So that is a great question. I don't believe that based on the physiology we heard today, it can stop you from sickling, but it can probably help you with other things, inflammation modulation, and things like that. So, and then somebody said, can it help with Alzheimer's and dementia? I can tell you one thing about the Sucavu nitric oxide booster. Because you have nitric oxide production in the vascular endothelium, which decreases and declines with aging. Nitric oxide boosters help with blood flow. So it can probably help with somebody who has vascular kind of dementia. So again, those are great topics, and probably we will look into the physiology a little bit more, but I know nitric oxide does help with memory. And I can tell you about my dad, who was becoming very forgetful from last year. He has been on nitric oxide boosters. His memory is the greatest it has been. Yeah, so probably you can be stabilized with nitric oxide boosting, the Sucavu nitric oxide booster. Okay, all right. I hope I was able to answer that question. We will do more research in sickle cell disease. I don't know, but I don't believe it will prevent sickling, but it might help with other things that you can see in sickle cell disease. And maybe Dr. Raymond, who is on the line. Welcome, Dr. Raymond. We're happy to see you. Maybe you've done so much research in this field, you may be able to answer that question.
Thank you, Dr. Lydie. Thank you for giving me opportunity to talk about sickle cell disease. And you say anything about, I think that research are going on, and only the complication of this sickle cell that CBD can help for the complication, but it cannot help for the the prevention now. For now, I don't know, but maybe we are going to see what is going on for all those research. Concerning Alzheimer, there is studies that are proving the action of CBD on prevention of Alzheimer. And the biomechanism is already known. And during our further presentation, we are going to show up concerning this Alzheimer's disease, all those diseases of the brain that are related to oldness. Thank you.
And I was just thinking about the nitric oxide booster and helping with blood flow. I believe that in sickle cell disease, everything is about circulation.
Yes. Yes.
And if you use a nitric oxide booster, you have to understand physiology and see how it could actually help in people who have sickle cell disease in improving blood flow. The nitric oxide booster from Sukevu. So everything is science, understand how it works, and then you can kind of know where it could help. And I can tell you, I have a woman in my church who has sickle cell disease. And at some time I was telling her to buy the nitric oxide booster. And I think it was maybe costs was an issue. So, and she said, well, I don't use anything that my doctor has not prescribed. And so I said, really? And then she had a very severe sickle cell crisis. And then I gave her a nitric oxide booster to use. Since then, she has not had any issues. So nitric oxide boosters will probably help with circulation issues. And I know that with sickle cell disease, one of the things that these red cells that are sickled, they aggregate and that they form thrombosis in your arteries. And that is what causes those pain syndromes that we see in sickle cell disease. So it is possible that indirectly like that, it can help with blood flow. So I think I've come to the end of my presentation. I've taken a lot of time and I don't want to hold up the next speaker. So please let me pass it over at this time. And I will be listening, but I'll turn on my camera because my husband needs me right now. So have a great rest of the afternoon. Thank you, Dr. Raymond, for chiming in about dementia and Alzheimer's. It's great. It's exciting. The science is exciting. I love it.
Thank you so much, Dr. Liddy. That was incredible. I appreciate you answering all those extra questions and enjoy being with your husband. That's always a good thing. Okay, so we're going to pass it over. Dr. Raymond, you are here now, so you're going to do the presentation, I'm assuming? Yes?
Thank you very much. Permit me to present Dr. Pengu, who is my closer partner, collaborator. And because I was too busy today, I did not knew that I will be free now. So he's going to make the presentation in my place. Thank you very, very much. Dr. Pengu, can you share the screen?
Okay, thank you, Mr. Director. A minute, let me share my screen with you. Je ne sais pas si vous parvenez à voir mon écran.
Oui.
D'accord. Ok. Bonsoir à tous. Je prends cette présentation en lieu et place du docteur Djoumé qui est ici présent. Je ne sais pas s'il serait à la hauteur de sa hauteur, si je me permets de le dire, à cette présentation, pour vous parler à la suite de la brillante présentation du docteur Liddy qu'il a fait en langue anglaise des maladies auto-immunes et de la relation entre les cannabinoïdes et les maladies auto-immunes. Alors, pour parler des maladies auto-immunes, ça ne sort pas? Ok, d'accord. Nous allons parler en définition. On peut dire que les maladies, ce sont des maladies associant une production d'anticorps, d'auto-anticorps qui attaquent les propres tissus du patient. Ça veut dire quoi en d'autres termes? Ça veut dire que l'organisme normalement ne doit pas combattre ses propres tissus. Alors, dans l'état pathologique, ce qui est des maladies auto-immunes, il y a des anticorps qui sont produits pour attaquer les propres tissus de l'organisme. On parle dans ce cas-là de maladies auto-immunes. Ici, on peut avoir deux types de maladies auto-immunes. Alors, des maladies auto-immunes qui sont spécifiques à certains organes. Certains organes, on peut dire les maladies auto-immunes spécifiques à la rate, spécifiques au foie, spécifiques à la thyroïde. Mais on peut aussi avoir, d'autre part, les maladies auto-immunes qui sont des maladies auto-immunes qui sont systématiques. Ça veut dire qui attaquent tout le corps, qui peut attaquer un ou plusieurs organes en même temps. Alors, comme maladie auto-immune, nous avons classifié deux types de maladies auto-immunes, dont ceux qui sont spécifiques à certains organes. En l'occurrence, on peut avoir des organes comme la glande endocrine, où on a des maladies comme les thyroïdites, la maladie d'Hashimoto qu'on a. On peut avoir des maladies qui attaquent le foie et le tube digestif, le système nerveux, avec des myasthénies, les pathologies ophtalmiques, la peau. Maintenant, comme maladies auto-immunes qui peuvent être systématiques, on parle des connectivites, des vascularites primaires et d'autres maladies. La liste n'est pas exhaustive. Alors, la rupture de la tolérance au soin. On dit les maladies auto-immunes résultent d'un dysfonctionnement du système immunitaire, comme nous l'avons bien dit, conduisant ce dernier à s'attaquer aux constituants normaux de l'organisme. Alors, ça veut dire que l'organisme lui-même produit des cellules qui s'attaquent aux cellules propres de l'organisme. C'est ce que ça veut dire en d'autres termes. Alors, c'est par exemple le cas dans le diabète de type 1, la sclérose en plaques ou encore des polyarthrites rhumatoïdes. Face à ces maladies complexes, les chercheurs développent de nouvelles stratégies thérapeutiques visant à contrôler le système immunitaire sans pour autant qu'il risque de baisser de grade vis-à-vis des agents pathogènes. Alors, ici, on peut noter que les maladies auto-immunes représentent 10% de la population dans les pays développés ou industrialisés, mais nous avons aussi 5 à 8% dans la population mondiale de personnes qui souffrent de maladies auto-immunes. Le ratio âge-sexe montre que nous avons 8 à 10 personnes, 10 femmes dans la population qui souffre de maladies auto-immunes. Ce tableau nous présente la prévalence des maladies auto-immunes avec un sexe ratio en faveur des femmes. Nous pouvons noter que la maladie d'Hashimoto, allant d'en haut vers le bas, la maladie d'Hashimoto a une très grande prévalence avec un sexe ratio supérieur à un sexe ratio 10:1, donc en faveur des femmes. De la tolérance immunologique à la rupture de la tolérance. Ici, il existe au moins 80 maladies qui sont dues au dysfonctionnement du système immunitaire. Les maladies auto-immunes sont multifactorielles. Donc, les maladies auto-immunes sont multifactorielles. Ils peuvent être d'origine génétique, ils peuvent être d'origine hormonale, microbienne ou environnementale. Les nouvelles biothérapies ont montré un contrôle efficace dans certaines maladies auto-immunes. C'est ainsi que Sukavo fait son apparition. Nous allons voir dans les prochaines diapos. On ne devait pas produire des anticorps contre ses propres antigènes. Nous l'avons déjà dit, quand l'organisme produit des anticorps contre ses propres antigènes, on parle ainsi de tolérance immunologique. Quand il y a rupture de la tolérance immunologique par des mécanismes complexes, le corps produit des anticorps contre ses propres antigènes. Ceci développe des maladies auto-immunes. On parle de maladies auto-immunes dans ce cas. Comment attrape-t-on une maladie auto-immune? Quels sont les facteurs favorisant les maladies auto-immunes? Ici, nous avons déjà dit plus haut que les maladies auto-immunes étaient multifactorielles. C'est ainsi qu'on avait la génétique, donc le terrain génétique, avec le rôle des HLA, le système HLA, qui est un système protecteur de l'organisme. On a aussi le rôle de l'environnement, avec la pollution et tout le reste. Nous avons aussi les facteurs endogènes. Dans les facteurs endogènes, on peut noter les facteurs hormonaux, les inflammations chroniques, les microbiotes intestinales. Nous pouvons retrouver aussi, d'ailleurs, les facteurs exogènes. Dans les facteurs exogènes, nous pouvons avoir des virus, le virus Epstein-Barr virus, les cytomégalovirus et certains médicaments en l'occurrence. Alors, ici, le tableau nous présente les symptômes des maladies auto-immunes. Nous devons noter sur cette figure que tous les symptômes qui figurent ici sont des symptômes des maladies auto-immunes, mais chaque symptôme peut être spécifique. S'il s'agit d'une maladie auto-immune qui est systémique ou d'une maladie auto-immune qui est spécifique à un organe. Alors, si la maladie auto-immune est spécifique à un organe, on peut avoir des symptômes. En cas de thyroïdite, par exemple, on peut avoir la fatigue extrême, la prise de poids, les mains moites. Mais quand la maladie auto-immune est systémique, on peut avoir plusieurs autres symptômes, en l'occurrence les symptômes qu'on peut retrouver ici, tels que les éruptions, les fièvres, les adénopathies, etc. Alors, le diagnostic d'une affection auto-immune. La démarche diagnostique consiste à faire des examens biologiques. En l'occurrence, on peut faire la CRP, la VS et la NFS. Donc, les protéines C-réactives, la vitesse de sédimentation, la numération formule sanguine. Ça, c'est ce qui est du bilan général ou un bilan d'orientation. Mais maintenant, quand il s'agit d'une maladie auto-immune, après la réalisation des éléments, des examens d'orientation, on passe aux examens plus spécifiques à la recherche justement des auto-anticorps. Ces auto-anticorps, comme nous l'avons dit précédemment, qui peuvent être spécifiques à un organe ou bien systémiques. C'est ainsi qu'on peut avoir les anticorps anti-DNA naïfs, on peut avoir les anticorps anti-cytoplasmiques, on peut avoir les facteurs antinucléaires, les facteurs rhumatoïdes, etc. Le traitement des maladies auto-immunes. Dans le traitement des maladies auto-immunes, de façon médicale, traitement médical, on peut avoir des corticoïdes. On note aussi que les corticoïdes sont utilisés dans le traitement des maladies auto-immunes en exploitant sa fonction anti-inflammatoire. Donc, c'est un très puissant anti-inflammatoire, mais les corticoïdes, comme nous le savons tous, ont des effets secondaires qui sont très dangereux. Des corticoïdes qui ne doivent pas être pris au long cours, qui peuvent entraîner des complications sévères. On peut avoir des immunosuppresseurs, on peut avoir des immunothérapies, on peut avoir des antalgiques, c'est ça les antidouleurs, des antalgiques contre la douleur, les biothérapies et thérapies ciblées et d'autres traitements spécifiques en fonction du type de maladie auto-immune ou de l'étiologie. Les objectifs du traitement des maladies auto-immunes. Comme objectif, nous avons pour rôle de contrôler l'activité de la maladie, c'est-à-dire de contrôler son évolution, l'évolution de la maladie, de prévenir les poussées, comme nous allons voir avec le rôle des CBD plus tard, de faciliter la conception de la maternité, de préserver la qualité de vie, de préserver l'insertion socio-professionnelle, de limiter les séquelles liées à la maladie, limiter les effets secondaires des traitements. Alors, ici, c'est un tableau qui résume en quelque sorte la physiopathologie, c'est-à-dire l'origine des maladies auto-immunes. Nous l'avons dit plus haut que l'origine des maladies auto-immunes pouvait être multifactorielle. C'est ainsi que ce schéma nous montre qu'il pouvait être on peut avoir des facteurs individuels, environnementaux, génétiques, comme nous avons dit, et épigénétiques aussi. Les anomalies de la réponse immunitaire. Comme mécanisme des anomalies de la réponse immunitaire, nous avons les situations d'activation immune qui nous donnent des phénomènes exogènes, dus à des phénomènes exogènes. Nous avons la production d'antigènes du soi en quantité augmentée et ou des déficits de régulation. Les débordements des capacités de régulation, les stimulations des cellules autoréactives par des cytokines amplificatrices. L'entretien de la réponse auto-immune. Ça, ce sont des mécanismes auto-immunes de la maladie auto-immune. Okay. Les cannabinoïdes, effets sur les maladies auto-immunes. Les CBD ralentissent la production des lymphocytes, ralentit la production des lymphocytes T et efface la mémoire du système immunitaire, réduisant ainsi la probabilité des futures attaques auto-immunes. Alors, ce paragraphe est en train de nous montrer l'importance des CBD dans les maladies auto-immunes. Ici, on nous dit que les CBD luttent efficacement dans la mémoire, vu que dans les maladies auto-immunes, ce qui accélère ou bien ce qui favorise les complications des maladies auto-immunes, c'est le fait que l'organisme garde en mémoire justement les cellules qui ont été identifiées comme étant des antigènes du corps. Alors, les CBD ici ont un rôle d'effacer cette mémoire-là pour ralentir l'apparition, ralentir ou empêcher l'apparition des maladies auto-immunes. Les CBD augmentent l'expression des gènes qui traitent le stress oxydatif. En d'autres termes, ici, on dit les CBD ici augmentent l'expression des gènes. Augmentent l'expression des gènes, dans l'organisme, il y a des gènes qui sont responsables de l'oxydation. Or, on sait que l'oxydation, les cellules oxydées sont nocives pour l'organisme. Alors, ils augmentent l'expression des gènes qui luttent contre l'oxydation de certaines cellules. Par conséquent, ils favorisent ou ils réduisent l'apparition des maladies auto-immunes. Les CBD sont en effet immunomodulateurs, contribuent à l'homéostasie. Les CBD agissent sur les cytokines pro-inflammatoires, la suppression de la sécrétion de cytokines et l'effet anti-inflammatoire. Pour éviter les maladies auto-immunes, éviter les sucres, la viande rouge, la caféine, l'alcool, les produits laitiers. Mettre un accent sur la consommation de poissons, de légumes, des graisses saines et des fruits. Comment fonctionnent les médicaments? Comment fonctionnent Comment fonctionnent les médicaments contre les maladies auto-immunes? La suppression de la réponse du système immunitaire. Alors, ici, dans la suppression les médicaments dans les maladies auto-immunes permettent justement de supprimer la réponse du système immunitaire. Nous avons ainsi l'exposition aux infections. Je prends l'exemple ici d'une maladie auto-immune où nous utilisons comme médicament les corticoïdes. Nous avons dit que les corticoïdes sont des forts anti-inflammatoires, mais aussi ont des effets secondaires très graves. Alors, quand nous utilisons les corticoïdes, nous rabaissons le système immunitaire. Le système immunitaire est affaibli dans ce cas-là. Alors, si le système immunitaire est affaibli, ici, le rôle des CBD, c'est justement de renforcer le système immunitaire ou d'équilibrer l'homéostasie entre l'inflammation causée par les CBD et réduire l'inflammation. Comment les CBD peut aider dans les maladies auto-immunes? Le CBD ne supprime pas l'immunité. Il l'équilibre et l'adapte en réduisant l'inflammation. Comme nous l'avons dit plus haut, il réduit l'inflammation. Il module le système immunitaire, comme vous l'avez dit. Évite les complications des maladies auto-immunes. Ceci est vrai pour le diabète de type 1, la sclérose en plaques, le psoriasis, l'arthrite rhumatoïde, les maladies inflammatoires de l'intestin, les maladies cœliaques et autres. La liste n'est pas exhaustive. Alors ça, c'est pareil. L'action des CBD sur la sclérose en plaques. Ici, nous notons qu'une récente étude a analysé l'effet des CBD sur des modèles de souris atteints de type de sclérose en plaques expérimentale. Les chercheurs ont mis en évidence une diminution de l'activité de la voie PI3K, etc., impliquant dans la régulation du cycle cellulaire et le métabolisme. Le traitement par CBD a permis de restaurer cette voie de signalisation et serait donc, d'après les chercheurs, une nouvelle cible thérapeutique potentielle pour le traitement de la sclérose en plaques. Ici, cette diapo nous présente le spectre des CBD que nous pouvons en voir sous plusieurs formes, comme Dr Lydie l'a si bien dit, en baume, en gel, en poudre, si je me trompe pas. Donc, disponible sur toutes les formes en fonction de la consommation des patients. Comme le témoignent plusieurs études à travers le monde, avec leur effet entourage, les cannabinoïdes contenus dans les produits Sukavo jouent un rôle majeur dans la lutte contre les maladies auto-immunes, en préventif et en curatif, par des mécanismes décrits plus haut. Ils sont conseillés à des doses progressives pour atteindre l'optimum efficace. En conclusion, nous pouvons dire que la physiopathologie des maladies auto-immunes est complexe, hétérogène entre les maladies auto-immunes et reste imparfaitement connu, faisant intervenir un grand nombre de molécules et d'interactions. L'immunité innée est également impliquée. Les facteurs environnementaux et individus, dont les médicamenteux jouent un rôle important dans leur survenue. Les apports thérapeutiques bénéficient d'une meilleure connaissance des circuits immunologiques impliqués, la plupart d'entre eux n'étant que suspensifs. Les CBD jouent un rôle important dans la régulation de la réponse immunitaire, la régulation de l'expression des gènes, la régulation des conséquences de cette auto-immunité par leur effet anti-inflammatoire et antioxydant. Ceci, je vous remercie pour la présentation et je laisse la peine au docteur Djoumé de corriger les failles. Merci.
Oh, merci, docteur Pengou. Merci beaucoup. C'est pas facile de... Je ne trouve aucune faille. C'est pas facile de faire une présentation aussi spontanément comme ça. C'est pas toujours facile. Mais l'essentiel, c'est que le message est passé. Les gens ont suivi l'essentiel des effets des produits Socavo et des cannabinoïdes sur la prévention des affections auto-immunes ainsi que le traitement des complications de ces affections. Il est très important pour nous aujourd'hui de changer de paradigme parce que nous savons tous que les médicaments utilisés comme immunosuppresseurs dans le traitement des affections auto-immunes sont des médicaments suffisamment lourds dont les effets secondaires sont importants. Et puis, vous savez, il y a des individus qui sont prédisposés à faire des affections auto-immunes, comme le docteur Lydie l'a si bien dit. Dans certaines familles, on trouve beaucoup d'affections auto-immunes. Je pense qu'il est temps que dans ces familles, qu'ils commandent à prendre des cannabinoïdes. Notre objectif, c'est beaucoup de plus éclairer des personnes qui souffrent de cette maladie et qui sont toujours dans l'option des médicaments, lesquels médicaments n'ont aucun effet préventif, ils ont uniquement un effet curatif et ils ont des effets secondaires graves, notamment, comme le docteur l'a si bien dit, l'une des complications de la corticothérapie, c'est le diabète induit par les corticoïdes. Nous ne parlons que de cela. Ça veut dire quoi? Vous avez une affection auto-immune, on vous donne des médicaments, ça provoque une autre maladie. Alors, moi, je pense que, sans toutefois dire qu'on va supprimer le traitement qui est mis en place contre l'auto-immunité, on pourra aussi, en traitement complémentaire, substitutif, pas substitutif, plutôt complémentaire, ou bien adjuvant, mettre les cannabinoïdes pour permettre à l'organisme de mieux supporter cette maladie, pour avoir un complément sur le plan physiopathologique, comme on l'a décrit tout à l'heure, pour minimiser les effets secondaires des médicaments et minimiser également l'impact et les complications de l'auto-immunité, des affections auto-immunes sur les tissus du corps humain. Je pense qu'il est évident aujourd'hui qu'on changera de paradigme pour aller vers des nouvelles stratégies thérapeutiques. Moi, je porte ici la voix de tous ceux qui pensent aussi que sur le plan naturel, en associant le mode de vie, la pratique de l'exercice physique, en associant également la compréhension de certaines maladies, c'est pour ça que nous avons pensé avec le docteur Zen, avec M. Zen, avec Mme Lydie, avec Mme Rosa et toute l'équipe de Socavo, on a pensé qu'il fallait, dans un premier temps, comprendre les mécanismes physiopathologiques des maladies que nous avons, comprendre les mécanismes biomoléculaires et moléculaires d'action des cannabinoïdes, d'abord chez les animaux, à savoir le rat ou la souris, et puis de plus en plus aujourd'hui chez l'homme. Donc, je remercie sincèrement le docteur Lydie, je remercie le docteur Pengou pour cette brillante présentation. Alors, nous sommes disposés à toutes les questions qui peuvent être posées concernant cette présentation. Nous sommes disposés. Alors, je ne sais pas si Madame Rosa a quelque chose à dire ou bien...
Yeah, Tammy, are you there? Hello, Tammy?
Hi, I'm here. Sorry, it
Yes,
takes a
yeah,
minute
doctor,
to
I
unmute.
know. Yeah, I know you're still learning French. So doctor is asking whether there's any question. If there is none, then it was a great presentation. I know by the time of 6 months you'll be speaking French fluent before you go to Cameroon.
Yeah, I'm all over it. I can say croissant. Not even that. Nah, Dr. Raymond's giving me the evil eye. That wasn't even good. That was a fantastic presentation. I understood none of it, but I know it was fantastic. There's no questions that I know of in the chat, so I think we are good. Thank you so much for coming. Thank you so much for presenting. Y'all are fabulous.
And tell me, all the people who came, if they would like to try the product, they can get in touch with all those who invited them to try.
Absolutely. Absolutely. If there's any questions, reach out to the person that invited you to this call. Be happy to help you.
Thank you.
Thanks, everyone. Have a great weekend.
Thank you, Tammy.
Thank you. Bye-bye.
Thank you.
Bye.
Thank you, Dr. Raymond, and thank you,
you,
Dr.
Dr.
Gifo.
Lizzie. Thank you.
Yeah,
Thank
Dr.
you, thank you,
Gifo,
thank you.
I was very impressed at a very short
Bye-bye.
notice and how you presented. That was really amazing.
Yes.
And
Thank
you, Dr. Raymond, for all the research you
you.
do for this. It's amazing.
Thank you. Thank you very much.
All
Thank
right.
you, thank you. Thank you for the director to give me this opportunity.
Yeah,
Thank you.
it's nice to meet people. It's amazing.
From Houston.
Yeah.
Thank you.
The same medical school, yeah, absolutely. You can tell that people are brilliant because you just study a topic in a short time and you can present it. It's just really amazing, That's very good. All right, have a blessed rest of the week. See you
Thank
next
you,
week.
Dr. Lady.
Bye-bye.
Bye.